have decided to extend the IUI camp for the month of June as well. Patients have been extremely happy and we have been able to give them good success rates, due to which we have decided to increase the time for this IUI camp. Thank you. Hi, I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Let's try to understand what the IVF procedure is and the timelines along with it. How much time will you be required to invest when you want to go through an IVF cycle? Remember that you will be asked to come around day 2 or day 3 of your menstrual cycle. This is a very critical thing to remember, because that's when we would like to start your treatment. This is a time when the ovaries are calming down, the endometrium is shedding, it's preparing for the next cycle, the ovulation, the egg to develop and all that. So therefore, at this time and position, if we start the stimulation, then the best recruitment of the eggs will occur. Therefore, day 2 or day 3 of your menstrual cycle is when you are supposed to report to your fertility specialist. That is the day when your hormones also will be assessed. Follicle stimulating hormone, luteinizing hormone, estradiol, progesterone, all these hormones give us an indication about the situation inside your ovaries. Should we be giving you too high a dose? Should we be giving you a low dose to begin with? And all these are correlated with an ultrasonography. So this is done so that we can decide on what stimulation, how much injections to give you, what dosage and what frequency to follow. Then remember that these injections are given for about 8 to 10 days, sometimes 12 to 14 days as well. So ideally it is better for us to stimulate you for around 10 to 12 days. This is ideal situation where the quality of egg will be good. In some situations, you may be ready by day 8 or you may take as long as 14 days for your eggs to grow. So this is a very fluidic, very volatile situation, and we go with each day's ultrasonography. During those days, you will be called around 2 to 3 times for a ultrasound. This is to understand if your ovaries are responding well, if we should increase your dose or decrease it, and if the ovaries are behaving well, not going into ovarian hyperstimulation where too many eggs are growing. So this is a very important thing for you to remember to come for these scans. Also during these scans, some hormone tests could be also done so that they correlate with the growth of your eggs and the hormones inside your body. Then around day 10, suppose day 10 to day 12, when we see that the eggs are of good size, and by good size I mean about 18 mm to 20 mm, that's when a very critical injection is given. It is called the human chorionic gonadotropin, HCG, or a leupride, depends on what your doctor is deciding to do based on the situation of your ovaries. If you're giving too many eggs, then they will probably give you a leupride injection. This is done so that you don't go into a hyperstimulation and the embryo transfer can be planned in another cycle. If an HCG is given, then 36 hours after this injection, whether it is leupride or HCG, human chorionic gonadotropin, the eggs are retrieved. So this trigger injection is of great importance, and you have to remember to take it at the time that is specified, because 36 hours later your egg pickup will be scheduled. If you are to miss it, do not panic. If you did not take it at the right time, do not panic. But remember, you have to intimate to your doctor and the team that you have taken the injection at a different time, because then from that time we will schedule it 36 hours later. If he told you at 10 o'clock in the night to take it and you took it at 12 in the night, don't panic, but just intimate to us that you have missed the injection at the time that we prescribe. After that, the eggs are collected and the procedure is then done, and in the lab next development happens. We are trying to mimic nature. Inside the lab, your husband's or partner's sperms are mixed with your eggs, or they are made to go through ICSI, intracytoplasmic sperm injection, where a sperm is put inside the egg, which is called day 0. So this day is called as day 0. Well, it's only an egg and a sperm, so they are just gametes and it's not an entity, therefore it's called day 0. The very next day, we come and check for fertilization. You can see that there are 2 pronuclei here, one from the father and one from the mother, and these pronuclei are checked on day 1. On day 2, there are 4 cells, around 2 to 4 cells is what is expected on day 2, and this check is very critical because we look for any abnormalities here. Are they too slow? Are they too fast? Are they showing too many nuclei inside each cell? All these things are assessed. After that comes day 3. At day 3, you can see around 8 to 10 cells are expected which then means that they're a good grade embryo. They have to be of the right size, shape, the number, all these things are assessed very quickly under the microscope. On day 4, they are called the morula, and they are just a hardball mass of cells at this stage. At day 5, they are called blastocysts, and at this stage, if you took some injections and progesterone to support your endometrium, we transfer the embryo or we freeze the embryo so that we can transfer it in the next cycle. The next cycle, we don't have to go through this entire procedure. Injections need not be given for us to collect the eggs because your embryos are already frozen. We will just be giving you medications to make your endometrium grow. It's a very relatively easy procedure. IVF is not as big as it seems to be. It's a very simple procedure. All you have to do is follow the protocol and listen to instructions that are given by a fertility specialist. You want to understand more, you are thinking about IVF and want more guidance and more support, please feel free to contact us on the numbers you see on the screen. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.